Hello, and welcome to Close Calls with California Poison Control System. My name is Race Bora. I'm the medical director at the Fresno Madera Division of California Poison Control, joined by my co host.
I'm Cyrus Rankin, Assistant Medical Director with California Poison Control System.
And today's featured speaker is Dr. Chris Ricidi, who is an emergency medicine specialist and a toxicology fellow at UCSF in San Francisco. He also assists our San Francisco division of California Poison Control. Welcome, Chris, and thanks for being here.
Yeah, thanks for having me.
We're talking today about spider bites, which are associated with a lot of anxiety in some of our viewers, as well as a lot of misinformation. So right off the bat, let's just tell everybody about, where do we find these spiders and why do they pose a poisoning hazard?
Yeah, so there are a few different types of spiders, really only a few that we are concerned about that cause toxicity. Especially here in California, the black widow spider is pretty common in our area, whereas you may have heard the brown recluse spider is not as common in our area. But both can cause severe toxicity and could cause you to be going to the hospital and be admitted to the hospital for treatment.
Definitely. We do hear from callers who have been bitten, as well as doctors and clinicians taking care of them, specifically about black widows. Can you talk a little bit more about what a black widow spider bite looks like, feels like, what patients experience whenever they get bitten?
Yeah, so the spider itself is actually, we'll show a picture later, but it's actually a black spider with a red hourglass look on its abdomen. And the bite is actually, could be mostly painless, but it usually is two small or one small puncture wound wherever they bite you. Whereas the brown recluse spider bite, it's a little bit larger wound and it's more noticeable than a black widow spider bite.
Good to know. And whenever black widow spiders are causing human disease, what sort of things do patients tell us?
Yeah, so when you get bit by a black widow spider, a lot of times the bite may be unnoticeable. They usually see small one or two puncture wounds that can progress to muscle spasms and abdominal pain, nausea, vomiting, and sometimes you see what we call localized area of sweating of where the spider bit you. Whereas a brown recluse spider, you see more of a necrotic ulcer, blackness of the skin. It's usually a larger wound.
So it sounds like the black widow can definitely cause problems that are kind of far away from the actual site of the bite as far as our pain and all those kinds of things are concerned in our body.
That's good to know. And I know the pain can be intense. It's usually something that can come on within a few minutes to a few hours, but then it can last for days. And even small children who've gotten bitten and that I've been able to treat require sometimes large doses of medications for pain and muscle spasm. What other sort of medications are used if a person does come to the emergency department with a black widow spider bite? Can you talk a little bit more about that?
Yeah, so a lot of times we actually treat it with just pain medications that we give in the hospital. And if you're having those severe muscle spasms or abdominal pain, you could treat it with anti-muscle spasm medication, which will help you feel a lot better. If those things don't work, and in very severe cases, we do have something called a black widow anti-venom, which can help reduce the amount of venom in your bloodstream. But just know that if you just get bitten by a black widow spider, not everyone needs this. It's only in severe refractory cases where your pain is not controlled with our medications given in the hospital.
Great. And this looks like it's an IV medication that's going to require a lot of intensive monitoring. And I know people are doing research on making better forms of antivenom, but this is still considered kind of last line for severe black widow spider bites. Is that right?
Yeah, that's right. And it's a nice picture. And you'll be okay.
Great. Good to know. There's a lot of options, and perhaps as a last line, antivenom is available for those really severe cases of black widow envenomation. What about brown recluse? Do you know how that's treated?
Yeah, I mean, it's similar way. You treat the pain. There actually is no anti-venom for brown recluse spider bites. So if you're getting bitten by the brown recluse spider bite, you're managing the wound, you're treating the wound, make sure it doesn't get infected, and then treat your pain. But there's no actual anti-venom for brown recluse bites.
When it comes to brown recluse, we as toxicologists often hear about people being diagnosed with the brown recluse spider bite, even when a spider was never even identified. And especially here in California, where, as you said, we don't really have this spider, what are the other kinds of medical conditions that we should be thinking about before we land on a diagnosis like brown recluse spider bite, especially in areas where it usually doesn't occur?
Yeah, so I actually see this all the time in my practice as an emergency medicine physician in the ER. Patients come in all the time. They believe they are bitten by a spider because they see a wound. But we want to make sure it's not an abscess, meaning there's not an infection with a fluid collection in your skin that may need drainage, which is a totally different uh, type of diagnosis versus the brown recluse spider bite. Could be a cellulitis, which is a soft tissue infection. Or it could just be a reaction to something that you were exposed to. So there's a lot of different other medical causes that is less likely a spider bite in California, or brown recluse spider bite in California.
So mostly infectious and inflammatory skin conditions sometimes get misdiagnosed as brown recluse spider, it sounds like.
Yeah, that's correct.
Great. Well, just to shake things up a little bit, we've actually put together a collection of pictures to share with our viewers, and we were hoping you could tell us what kind of spiders are these that we're going to be looking at, and where people might encounter them. Just because we do get calls about all kinds of different critters at Poison Control, and we just thought that this might be a fun way to share some of the images of the creatures that you sometimes hear about. So let's play Name That Spider, and our health education team can kind of play our pictures here, and we'll let you talk through what we're looking at. So with this first picture, name this spider. What are we looking at here?
So that one is a brown widow spider. It's similar to the black widow. It's a close relative of the black widow. It also is venomous, but a lot of times its venom is less toxic than its cousin black widow. But you could see on the belly, you see the hourglass sign underneath.
That characteristic mark of orange to brown, sometimes red, hourglass-like mark. Awesome. How about this? How about this creature?
Yeah, this one probably people are more familiar with. This is a tarantula. A lot of people have it as pets in their home, but know that these are usually pretty shy spiders, and they won't attack you. And even if they do or give you a small bite, it's not really toxic, and it won't cause you that much harm. If you do see the small hairs on the legs, those can sometimes give you some irritation on the skin, but it's overall fairly non-toxic.
That's good to know.
This one is the brown recluse spider. You could characterize it by, it looks like a fiddle on its head behind its 3 eyes. This is the one we were talking about prior.
The fiddleback. Okay, great. Not seen in California, but good to know that we can identify them through their characteristic markings.
Yeah, and this one is our black widow spider. So you see the jet black abdomen and the spider body with the characteristic orange or red hourglass on its underbelly.
Great. And this is something that's very commonly found. People tell us that they see these in their homes, in their backyards, quite frequently. So this is the one that we get called a lot about at Poison Control. Spider bites from black widow. All right, great. Well, thanks, Chris. I think we have one more. Oh yeah, what about this guy?
Yeah, this one looks harmful, but it's actually not harmful. It's a yellow garden spider. You may see this in your garden on a web, but it's not going to attack you, and it's mostly non-toxic.
That's great. Well, it's a very beautiful creature. Well, thanks for playing Name That Spider, and I think you shared a lot of great information. Let's wrap it up with some safety tips before we close. What should people take away from this discussion? What can we do to keep people safe from spider bites, especially black widow spider bites?
Yeah, so like I said before, spiders usually like dark spaces, and if you think like a spider, you may find yourself in a shoe or in a dark crevice or in woods. So if you keep your shoes outside, if you're keeping your backyard, make sure to clean out your shoes. Make sure to shake it out before you put your foot in, so you don't get an accidental spider bite. In addition, make sure to wear protection if you're looking through a bunch of wood or your garage or your shed. Make sure to wear both gloves and also hat protection to make sure the spider doesn't fall on top of you if you're cleaning stuff on top. The third thing is we want to make sure if you are bit by a spider, you can always call us at the Poison Center. But if you're having any severe pain or muscle spasms that's not relieved at home, definitely make sure to find yourself to get help in the hospital.
Great. Well, thank you so much, Chris. Really appreciate you sharing those great safety tips. As always, viewers can call us at 1-800-222-1222. And our poison control staff are happy to answer any questions about spiders or any other creatures that you find and you're curious about. Stay safe out there and have a great day. Thank you.
Thank you.
Thanks, Sai.